Hi, it's David Liew here for QD Clinics. Another QD clinic today. Patient I saw earlier in the week. And the presentation I think we probably are all familiar with from the clinic. So it's a 54-year-old lady who came in and she'd been referred in with lots of arthralgias and myalgias. That was where the referral was at. And really over the last 6 months, she'd been having problems with a lot of different joint pains and muscle pains, and it was really difficult for her to describe all of them. And I'd ask her where they were, and she said, well, they're everywhere, but really my neck, shoulders, back, but really in a lot of different places. And she was struggling to locate them. So really, this had been building over the last 6 months, a lot of fatigue, a lot of lethargy. She was postmenopausal. She'd been after the change in life. So otherwise pretty healthy, just asthma as a comorbidity. But she'd really been struggling with this. It's really brought her down progressively over a couple of months, and really, and the last 6 months had not been fun with her for her, and she'd been struggling, and she was struggling in the consulting room. And I had some labs there. ESR was 30, CRP is 15 from primary care. But we were struggling to get through some detail. So sometimes what I do in this situation is that you need to take a bit of a circuit breaker in amongst here, because the patterns of pain and exactly where they're affecting are clearly very important. It's very tempting in this kind of patient to think, well, these are all postmenopausal myalgias and arthralgias that are really sarcopenia leading to mechanical tendinopathies, or perhaps this is all fibromyalgia, but perhaps it's not. And especially when you've got labs like that, which are not entirely normal. So what I do in this situation sometimes is I give patients a pre-printed mannequin that I've got there on my computer, print off a template, and I gave her the piece of paper and a pen. I've got one which says pain and one which says stiffness. And I gave her an opportunity to color in and really try and draw it out. And often that's really a way of just trying to capture when things are affecting a lot of different places, to really try and locate that down in a way which doesn't feel overwhelming. For her or for me, in reality. So I got her to fill that out, and she really it was really revealing. She colored in really the shoulders, the lateral hips, lower back, just around the buttocks, around the ischial tuberosities, then a little bit around the elbows, a little bit around the posteromedial knee, so just on the inside of the knee. And it's really the pattern that we classically see from polymyalgia rheumatica, especially when it affects outside of the shoulders and the hips. And these are the patterns that we see on imaging as well, but these are the patterns we often see clinically. It's probably under-recognized, but really this didn't seem like fibromyalgia or postmenopausal arthralgias at all. It seemed very much in keeping with polymyalgia rheumatica. So good news is I did end up giving her 15 milligrams of prednisolone, and I called her last night to see how she's going, and she's doing really well on that. Everything seems to have melted away like, what's the phrase, spinach and Popeye, as we said earlier in the week with our Tuesday night rheumatology. So I think that's an important lesson, in that we sometimes, if we're struggling to be able to locate regional pain, regional stiffness, then having a different modality like a piece of paper and a pen can be enormously powerful. For more QD clinics, keep on tuning in to this month's QD clinics of our PMR month, because we need to make room for PMR.